What your tongue says about your health. Bright red tongue. A bright red tongue indicates that your body lacks essential nutrients like vitamin B complex and iron. Some herbalists suggest that it indicates heat in specific organs. It can also take place as a reaction to a certain type of toothpaste, medicine, mouthwash or acidic foods. Purple tongue. A purple tongue indicates that you might be having chronic bronchitis. In such a situation, oxygen is not supplied to the body efficiently. Purple tongue may also indicate high cholesterol levels. Poor circulation may also be the cause of this color. Consuming too much of cold foods can also cause the tongue to turn purple. Consuming foods like garlic and ginger may turn the color back to pink, otherwise consult your doctor. Pale or yellow tongue. Pale tongue indicates that you might be having low hemoglobin. It may also indicate fatigue and weakness. Pale tongue is also associated with problems in the lungs and colon. You can take herbs like garlic, cinnamon and ginger to resolve the problem. To increase your hemoglobin, take spinach, beetroots, red meat, kidney beans, raisins, apples, mangoes, apricots and nuts. Black tongue. From time to time, a person's tongue may take on a black, hairy appearance. Black hairy tongue is a harmless, temporary, but unsightly overgrowth of tongue hair, papillae, that traps bacteria and other mouth debris. White tongue. White tongue often means the same thing as black or yellow tongue, bacteria stuck in dense tongue hair. And it shares some of the same causes, too: smoking, dehydration, dry mouth due to mouth breathing. The white look means there are bacteria, dead cells, and debris wedged in the papillae. Red tongue. A red tongue more often signals underlying problems in children's health. A strawberry or raspberry colored tongue can be one of the first symptoms of scarlet fever or Kawasaki disease. Adults less often manifest these signs. But if your mouth hurts and your tongue looks smooth and red, your diet may be deficient in niacin, an important B vitamin. Brown. A spot on the tongue that has turned brown or otherwise darkly discolored could possibly be a form of skin cancer called melanoma. Red spots texture. Red spots on the tongue could indicate several problems. It may indicate that you have a deficiency of bioflavonoids, a compound present in vitamin C. You can get bioflavonoids from berries, kiwis and citrus fruits. Consuming hot beverages may also cause red spots on the tongue. Red spots show signs of asthma, eczema or some other allergic reactions. Dryness. Dry tongue tells that your body is producing too much mucus. To avoid this situation, cut down on dairy and sugary products. Another factor is stress, which can cause the salivary glands to swell and therefore your tongue becomes dry. This condition can be easily resolved by consuming a glass of lemon water. You can also treat it by reducing your stress levels. Seek help from yoga and meditation. Swelling. If you feel that your tongue has swollen, then there are chances that you might be having some sort of allergy or infection. Deficiency of vitamin B12 may also cause this problem.
AAI Clinics, no excuses, just results. Give us a call for a free consultation with one of our clinical advisors.